We are a hurting nation. For those who medically need them, opioids are important. But the challenge is to make sure that only those who really need them get them. For example, the same percentage of people in the United States, France, and Italy live with chronic pain, but Americans consume 6 to 8 times as many prescription opioids. Reports from the National Institutes of Health show over 23 million Americans report living with a lot of pain.
You know, I'm a pharmacoepidemiologist, and we study the use and safety and effectiveness of prescription drugs. And one of the principles of pharmacoepidemiology is that the value of a drug is not an inherent property of the product itself. It depends upon how it's used. If you have someone that comes in...
Dr. Caleb Alexander is the co-director of the Center for Drug Safety and Effectiveness at the Johns Hopkins Bloomberg School of Public Health. Alexander and his team examined the policies for Medicaid, Medicare, and major private insurers, looking at their coverage policies for drugs to treat chronic lower back pain. Their conclusion, published in the Journal of the American Medical Association: these policies steer people toward opioid use instead of safer and effective treatments like physical therapy and acupuncture. Commercial plans also made opioids cheap. The median commercial plan placed 74% of opioid painkillers in Tier 1, the lowest cost category. The copay would be $10 for a month's supply.
We do now have randomized trials, however, that demonstrate, for example, for chronic knee arthritis, acetaminophen or Tylenol may do just as well as opioids over the long term in managing pain. The point is that that opioids aren't inherently bad any more than a hammer or a razor blade. It's how we use them that can make them helpful or harmful. And for someone at the end of life who needs palliative pain care, they can be invaluable. They can be invaluable for someone in childbirth or someone that is, has an acute hip fracture. But the point is that they aren't risk-free, and they're highly habit-forming.
The CDC's current guidelines are that non-opioid therapy is preferred for chronic pain outside of active cancer, palliative, and end-of-life care. Research is still teasing out what puts some people at risk for developing opioid use disorder, but known risk factors are genetic predisposition, including a family history of substance abuse, psychological factors such as stress, depression, anxiety, eating disorders, or other psychiatric disorders, and personality traits like impulsivity or sensation-seeking. Environmental factors such as childhood trauma, access to addictive substances, and starting to use alcohol, nicotine, or drugs at an early age.